The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susy. I'm happy to say we're both here today. Welcome back, Susy.
Well, thank you.
Yay.
Yes, I'm back. I have missed our time together. Unfortunately, I had something come up in my life that needed my full attention. I had to have cancer surgery, and this was a shock to me. I did not expect to get cancer again. It's been 5 years, almost exactly to the day from when I had cancer surgery before. But this time it was a little more intense. Last time I had surgery and radiation. This time I had to have a mastectomy, which was a big deal. And fortunately, I do not need chemo and radiation after having surgery. So, I think I'm a walking example of how easy it is to be in denial. Because I was in denial. I
Why
thought
do you
to myself,
say that? Yeah.
I thought I wouldn't get cancer again.
Oh, I see.
I mean, I really didn't think I would. And I thought, the last time was really pretty minor. It was a pretty low risk. I opted not to take hormone blockers. I'll be fine. And then when it came back, I was like, whoa, wait a minute here. Here and also I live a pretty healthy lifestyle. I would say I eat really good. I'm not perfect, that's for sure. I'm what I would call a yo-yo exerciser. I exercise, but I'm not perfect at that either. And, I grew up in an environment where I never smoked, but I grew up in an environment, both my parents smoked. And then, of course, when I was young, I was around other people who smoked, but I never did.
Yeah.
But I drank alcohol, but not very much. I've never been a big drinker. Now I don't drink at all. And in fact, I was the kind of person that when I went to the doctor, they'd say, well, how much do you drink? And I'm like, I don't know, like 2 a month, that kind of thing. So I also got tested to see if my cancer was genetic or if I carried the gene for cancer. They also tested me for a whole bunch of other genes. But because I have a daughter and a granddaughter, I wanted to make sure that I did not have what's called the BRCA gene.
And also your mom was adopted, I remember.
Right. My mother's adopted, so I didn't know.
History.
So I was tested both times. And this used to be an expensive test, but now it doesn't hardly cost anything. So I do not have the inherited component for cancer.
Yeah. Let me just say here, first of all, I'm so glad you're okay. And I hope everybody's getting the message that because Susy stays on top of her doctoring, as do I, and hopefully all of you, it was able to be caught fast enough that she could get the surgery without requiring radiation or chemotherapy.
Right. And mine was very close to being invasive, but it was not.
Yeah. So she got it in the nick of time for that. And for those of us who've had cancer surgeries and such, the surgery is less intense than the radiation and chemotherapy on the body overall. It's just like one and done, and you get over your surgery.
Right. So, radiation I found was intense last time, but I would say chemotherapy is a lot worse, personally.
Yeah. Right. Yeah.
And I know people who've had to go through chemotherapy, and it's been horrible. Yeah.
Yeah. Whereas for me, with the throat cancer, the radiation was much worse. And many people need to be hospitalized and put on intravenous feeding tubes because your throat
swells.
I don't want to go into the gruesomeness.
Right, yeah. But I just remember I was worried about you. Let's put it that way.
The thing I'm fine. So another important point you just brought up is that when we get cancer, that's the first question I ask, did I inherit this? Because those of us who are involved in such healthy lifestyles, we want to believe that I haven't done anything to cause this. Have I, doctor? Like, I'm living such a clean lifestyle. It's almost easier to accept, I had an inherited gene that I was born with, so there's nothing I could do. But the reality is that less than 10%, like some say 5%, up to 10% at the most, have an inherited gene for the cancer. And in 90% to 95% of all cases, it is something to do with environmental factors. And
Yeah, it's
and
really
that's what you're
true.
going to talk about next.
Yeah, I think it's just really important to realize that so many things that can cause cancer, we don't have a lot of control over. We do have control over some of it. My first degree was in environmental health, and what I studied there that affected me the most was how toxins in the environment affect you at the cellular level. Because what they do is they cause a gene mutation in your DNA of your cells. So when you do that, anytime anything gets mutated, it becomes more vulnerable.
And let me just add here, toxins in the environment, our bodies are the environment. So Susie isn't necessarily meaning the environment out there outside our bodies, because anything toxic that we put in our bodies, we're putting a toxic thing into our environment being our bodies. Yeah.
Right. But also, as an environmental health person, I am concerned about what's out there in the environment that people don't have any say over. You know?
Our generation started with that, because Susie and I grew up with, like, they use DDT in the backyards to kill the mosquitoes. In summertime, we're out there playing, and the next door neighbor's blowing the DDT.
Right.
Like,
Hey, doctors used to smoke cigarettes on TV. I mean, what are you going to say? But when cells mutate, they just become more vulnerable, and so that can definitely impact what happens, and it can lead to disease, not just cancer, but it can lead to other kinds of diseases as well.
Well,
So
let
you
me
just
just
wanna,
add that is why aging is one of the biggest risk factors for cancer, because as we age, cells mutate. And all we can do is the best we can do to make sure the mutation isn't into a cancer cell. And we may not be able to do that. So,
right. We can't always control everything. I mean, the idea that you can disease-proof your body is just not true. I mean, it just doesn't work like that. But the two things that you can really do, one is to protect yourselves, protect yourself as much as possible. The modern environments we live in are not always ideal. The food that people have access to is not always ideal. The amount of things in our environment we can't control. And secondly, we need to do things to protect ourselves. So there's a lot of research, out there about eating the right foods and doing the right things for our body to protect ourselves. Now, that does not mean that if you do that, you will never get cancer. You will never get diabetes. You will never get heart disease. However, if it gives you that percentage of protection, it's well worth the effort, in my opinion.
Yeah. So what Susie's saying in part is that cancer cells flourish best in an inflammatory environment. And so what she's been telling us the whole time, to decrease inflammation, by doing that, decreasing inflammation in our body, we are decreasing the ability of a cancer cell to flourish.
Right. I mean, I think it's frustrating. Sometimes I just don't want people to give up. I don't give up saying, well, I'm going to get cancer anyway. No, that's not the case at all.
Yeah.
I mean, some people smoke cigarettes until they're 100 years old. They don't get cancer. Some people drink alcohol like a fish until they're 95. I mean, it isn't, you just increase your chances when you don't protect yourself. You're just not helping yourself at all. Yeah. And like we've talked before, it is, and Margaret has said, it is kind of a thing of aging. I mean, obviously we look at the population, there's only 1% of cancers that happen in young children. Thank God, but the statistics just go up as you get older. Yeah.
Yeah.
And a lot of that is just you live long enough. They say that most men die with prostate cancer if they live to be over 75 years old. So, do they necessarily get prostate cancer, maybe not. You know, maybe
So if
maybe it
it's not
doesn't.
fast growing, it's something in small amounts. It's something the
And
body
it's just
can live
present.
with. It's just
Yeah, it's present, but
present.
not affecting them. Yeah.
Mm-hmm.
Yeah. So I just think that we really need to be good to ourselves and good to our bodies. I also think it's important to realize that you need to listen to your doctors. They're the ones who know about a lot of things that we don't know about. It's real easy. Like, since I got cancer, if I go online and I look at anything and you go onto social media, all this stuff comes up about, oh, do this and you won't get cancer. Do this and you won't get this. You know, well, guess what?
It's not true.
It's not necessarily true. You need to listen to people who are in the field of oncology. We're fortunate, both Margaret and I, to live in communities where there's really good oncology doctors, and we're very lucky. But there's lots of good oncology doctors all over the country, and it's important to listen to them and take their advice. There's also integrated medicine that is starting to become more and more widely used. My oncologist has a lot of patients who work with naturopaths, and physical therapists and massage therapists and a lot of things. One thing I'm doing right now is I'm taking a medication to prevent myself from getting cancer again. And one of the things that can happen is it can cause joint pain. So I've started exercising because I don't want that. I don't want to live the next 5 years, being uncomfortable.
Yeah.
And I made up my mind to give that a really honest try this time. So
yeah. Well,
so important.
as you said to me earlier, that statistically cancer is a disease of aging, and we can't help the fact that we're getting older. And now, and Susie and I both know that our bodies can replicate cancer cells. Thank you very much, bodies. And so we're doubling up our efforts, as each cancer is different. Like in my case, I had throat cancer, and it turned out that the type of throat cancer I had, one drink a day
can lead to that.
will lead to it. And so I no longer drink. I no longer
breast
drink.
cancer also has a very strong causation from alcohol.
Oh, and Susie no longer drinks either.
Yeah, I don't drink anymore. And my father died of cancer when I was 17. So I, immediately thought, maybe I have a genetic predisposition for cancer. But as it turned out, that wasn't the case.
Yeah. I asked the same question of my doctor, same answer. And so it's the aging itself, because our immune systems are weakening and the cell oxidation increases. That's what increases the ability of those cancer cells to replicate. And I wanted to be clear that even though maybe like 25% of aging people might get cancer, 40% of those cancers are on the skin. Like our exposure to the sun without, and the UV and it's
and a lot of those are pretty minor, right?
Yeah. And
skin cancer can be fatal. Yeah, but
most are
mostly
not.
it's not.
Most are not. So just stay on top of that. And
and don't smoke cigarettes, for gosh sakes. There's a lot of things wrong with that. I got my husband to quit using tobacco by saying, you're supporting the tobacco companies. Don't do it.
Well, they say I worked in public health. The number one thing is like putting the prices up. That's the thing that helps the most. But
people, boy, I don't know what a carton of cigarettes costs these days. I have no idea. Way more than I would ever spend. Let's just put it that way.
So I'm so glad that you're okay.
I'm feeling good.
What do you want to end with? What do you want to tell people?
I just think it's important to listen to your own body, but also to listen to your healthcare provider. Get your screenings. My case might have been even better if I had gotten my screening a little bit earlier. I go once a year. Maybe I could go on a little more often, but hindsight's 20/20. I'm not saying blaming myself. It's just get your screenings. I think it's really important.
It is.
Yeah.
And listen to your body too. It is the most intimate relationship we have is with our own bodies. And so I know for me, sometimes my body will just say, get this checked out or something. And then I do it. I do it because we want to be as loving and good.
And sometimes it ends up being nothing, like you go, I just had an ultrasound on my leg because I was worried about some ankle swelling. Turned out to be nothing. It's probably just a side effect of a medication. But, it's important to always take care of that and always listen to your doctors, listen to your body.
Well, I'm so glad you're well, and I want people to see this as a hopeful thing that Susie is fine. She doesn't even need any follow-up treatment now because she got in there and she took care of it, and
and I had an excellent surgeon.
She looks great.
Yeah.
So we're gonna end this one here, and thanks for listening. Please like and subscribe.
Yes.
And until next time, we are
staying alive.
You've been listening to Staying Alive with Margaret and Susy. This show is hosted by Margaret Cooley and Susy Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusy.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.